if you've ever gone to a symphony, it's kind of like, the people who are orchestrating this and setting all of this up. It's when do you bring the strings in versus the bass, or when do you bring in the piano or the bass section, and at some point they'll all be operating together as we get to functional ILC and FLC, and that's when we'll hear the music.
Hello everyone, thank you for joining us for this RISE update. My name is Ron Haskell, Director of National Broadcast Programming at VHA, and joining me across the table is the Honorable John Bartrum, our Undersecretary for Health. Over the past year, VHA has been building the RISE organizational structure, a deliberate effort to strengthen how we support veterans and how we support each other. Over the past several months, Undersecretary Bartrum has been traveling across the country, hearing directly from employees and veterans about what's working well and where we need stronger, clearer support. Those insights, combined with the foundational work that's now complete, have shaped the next phase of RISE. We're now moving from designing the structure to operationalizing it, aligning leadership, refining functions, and beginning to pressure test the organization in real time. Today we're going to walk through what that means and what employees can expect moving forward. Sir, thank you for being here. You ready to jump in?
Sure, let's do it.
All right. Before we do dive in to the implementation phase discussion, I think it'd be good to remind people what the purpose of RISE is and what it isn't, and what do we hope to achieve through RISE?
So the reorganization will reduce duplicative management. It will make sure we put the right people in the right place of the organization, and it's not a reduction of staff. We're not reducing any staff as we go through this. So this is really putting the right people in the right place to do the right level of work. And it impacts 10% of our organization because the focus is at the headquarters and the VISN level. And so right now, the way our organization is structured, policy, guideline standardization, and implementation is done at both the VISN, at both the headquarters, and lots of other program offices around our organization. As we move forward, policy will be developed at the headquarters level. Implementation or standardization of that policy will be done at the middle level, or what we'll call our operations groups, such as the medical operations groups or the MOC, the business operation group, the clinical care hub, which think about all things community care, and the execution will occur between the VISNs and the facilities. And so they will take it and implement it. Because today what happens is if a policy comes out from the headquarters, they may also develop standardization in it and start to execute it from up here. Or they may develop a policy and send it out to the VISNs, and then all 18 of the VISNs will develop their own version of the policy and then their own version of standardization. And then they'll provide additional flexibility at the local level so that the policies and the execution standards will get modified slightly again. And once you get out, you get somewhere between 18 and 170 different versions of what the policy is and what the standard is. So when our veterans move from one part of the country to another, or providers move from one part of the country, or we're just trying to standardize other things, we find out that there is no standard to base it on. And so again, this reduces the duplication of layers and eliminates that friction, and it creates a more standard organizational model.
Okay. There's been a lot of, I mentioned at the top, a lot of work that's gone into it up to this point. So what have we achieved so far to date, from the analysis to where we are now?
Sure. So over the past year, the first 9 months was spent analyzing other organizations and developing the organizational structure so that we have what we have now with the new VISN structure of 5 VISNs, the new Medical Operations Center, which has clinical service lines, coordination lines, operations centers, financial operations center, a business operations center, a community care hub, which will handle the community care aspects of our program, and then the realigning of the VISN. But that was only part. Once you got the structure laid out, then we had to start doing the framework design. And on the framework design, we took that foundational framework and we started looking at what are the roles and responsibilities of each of these functions that we do today and each of the functions that we do that we'll have to do continuing to go forward, because they'll continue. It's just they're going to be in a different box with a different alignment.
Right.
Then we did a structural implementation where we took the folks who are going to be the senior leaders of those boxes and the subject matter experts of those functions. And they started to do what we'd call face-to-face and tabletop organizational analysis to say, what do we need to do? How do we need to do it? What of that role is a policy role versus what of that role is a implementation role versus a standardization or an execution side of it. We also did administrative mapping.
Mm-hmm.
And so we had to map and align all of the different activities that have to happen during the fiscal year. And so in addition to the functional alignment, we had to do a cross-functional alignment.
Yeah.
So we had to look at things that cross all of the different barriers. So think about contracts, think about grants, think about personnel system, computer systems. How do those cross and interact? And so we've done the functional and the cross-functional alignments. And now we are at the stage where we're really excited as we're going to initial operating capability, or IOC.
Mm-hmm.
Initial operating capability will be a phased approach, and it will start by putting the senior leaders, or what I call the top 11 leaders, so the new VISN directors, the MOC director, the new center directors, the ADUSH, the DUSH, that report to me into their boxes, so then we can start what I will call lifting and shifting. HR will have a different term for it, but moving like functions over to where they need to go. So in the national programs at the policy level, that's pretty much a lift and shift from the old org chart to the new org chart. In other areas, and some of the IT functions or performance management functions, there's part of that's a policy, and part of that is in, like, for example, the operations center, or part of that might be in the business operations center.
Mm-hmm.
And we'll be doing those moves over time. As we build that capability out in the IOC model, they will become functional IOC, to where they will start taking the day-to-day responsibility for those roles.
Mm-hmm.
But initially, we will continue to have the current structure we have until we get to the functional IOC. And then once we're at functional IOC, we'll move farther down the road to where we are at FOC, our fully operational capability, and then we will have the entire system under the new structure. There will still be adjustments and changes that get made for the next year or so after that, as we standardize processes, adjust policy documents, and the like, but we will be operating under that. The timeline right now is, as we move on May 1st to go to IOC,
Mm-hmm.
and over the summer we will start expanding into functional IOC, that when we get to the end of September, our current plan is to be at FOC at that point, and then to do the completion of the programmatic shifts that we have to do over the next 6 to 12 months afterwards.
It's an intricate web to sort of untangle, isn't it?
If you've ever gone to a symphony, it's kind of like, the people who are orchestrating this and setting all of this up. It's when do you bring the strings in versus the bass, or when do you bring in the piano or the bass section, and at some point they'll all be operating together as we get to functional IOC and FOC, and that's when we'll hear the music.
I like that analogy. See, you were talking about HR having a different name for lift and shift. As a Navy guy, I was thinking we're establishing the beachhead team.
Exactly.
Also an intricate planning process, right? There's been a lot of planning with teams meeting, and you mentioned all that that inform all this, but you've also done a ton of travel across VA's facilities. You've been talking to employees, been talking to staff. What have you heard that's reinforced the need for our RISE and restructuring? And how does that inform that? What are some examples or some things that you've heard out there?
Yeah, that's a great question. I mean, besides all of the esoteric things that we read in IG reports and hearing from people on Congress and all the different commissions that said we needed to do something like this, the more important thing to me was, what did I hear on the ground? And what I heard on the ground overwhelmingly is, this is needed. We need to have a more streamlined approach. We need to have a place where we understand what the policies are, and that the policies that we get today aren't necessarily clear. And for employees and for veterans who transit our different facilities that are in different VISNs or different parts of the country, they see the disconnect in our policies and how we implement our policies.
Yeah.
And so what I've heard from veterans and staff is that this is long overdue, and they're looking forward to having more consistency across the entire organization. What I've also told them is that even as we get to consistency, this is not going to be, you have to do it 100% this one way. There's going to be some right-left boundaries. The real is what's the output and what's the effect on veterans. And I'll give you an example. I recently had somebody reach out to me who was a patient under one program in one facility,
Mm-hmm.
and when they went to the other facility, they're like, no, you don't qualify for that program. Well, nothing about the veteran changed,
Yeah.
and nothing about our policy changed, but it was how VISNs were implementing that policy. And so we were able to go in and help modify the policy implementation at that one hospital to fix that, so the veteran got the same level of care and the same level of treatment at that facility. But those things happen across our system more often than they should, and this is to reduce that variability so that it's more consistent across the board.
Okay. We talked about how we're shifting from the framework developments into operationalizing things. You mentioned a little bit about this, but for employees that are hearing that for the first time, you talked about getting the symphony together. What does that shift actually mean to them? You mentioned that the leaders come in, but then is it from then largely a lift and shift where people are just moving to different organizations? What does that actually mean if you're in a program office that's aligned to VACO or a VISN? What does that actually mean for them, or what can they expect?
So in the main, I think the majority of the people will be just a realignment of function, or leadership function of who they're aligned to. Some of the functions will, and some of those offices will be split to the people who will do it at the policy side versus the people who will do it in the operations side. But so that is being worked and has been worked with their leadership, and most of them have been involved. There's been thousands of folks involved in this process, and tens, if not hundreds of thousands of hours over the past year on this process. And so for the 90% of our team that are in the facilities, they'll see little to hardly any impact on that. But to the 10%, they will see a realignment of who their reporting chain will be. In some cases, it's just at the top. In some cases, it might be in the middle as well. It'll just depend on what their function is. Because right now, we have offices at the headquarters who are not only doing policy, but implementation and execution. And so as we break that apart, it'll have to align to the new structure. Similarly, we have offices in VISNs that are doing policy, and as we move those around, some of those folks might be more aligned to a policy office, and others will be more aligned to an operations center at the business center, or at the community care hub, or the medical operations center, what we call the MOC.
Okay. You talked about pressure testing and tabletop exercises. Those of us that are veterans have done those, and wargaming and things like that. I'm curious, what do you hope to learn from those tests? What sort of insights is leadership gaining? We stood up the IOC. We're sort of testing these different things. What sort of insights are you pulling from that helps inform the next step when we do the FOC?
Sure. Well, as all of our veterans will understand, is that no plan is ever perfect.
Yeah.
And so if you don't take it out and before you start to implement it and walk through the assumptions and walk through the actual process together with subject matter experts from other sides of the program, you won't know where your weak points are. And we're running a healthcare organization, and we're not stopping our running a healthcare organization. So we don't have room for massive errors or failures in how we implement this. So we have to take those processes, and we'll continue. As we go into IOC, the leaders of those those 11 will be sitting down every few weeks together to say, what is the standard process for this? How do we make sure it works? And pressure test a portion of it and run through what could happen, what might happen.
Yeah.
Is there a better way to do it? And then on the on more macro level, to actually tabletop it and say, here's a scenario. We're writing a policy on this. How are we going to make sure that the guidance is aligned with the policy, and that the policy is then implemented through that guidance at the facility? And then we're also, as part of this change, implementing a self-inspection program.
Yeah.
And that self-inspection program, one of the things that they'll notice at the facilities is that it will reduce the footprint burden that we have right now.
Yeah.
Right now, our program offices, so it's been told to me that about every 10 days we send a team out to a facility.
Mm-hmm.
As we go to an integrated self-inspection team, we will reduce that footprint significantly. There will still be other teams that will go out there for some specialized type of activity, but in general, it will be those self-inspection teams that will be an integrated team, which will provide the people in the facility a more holistic view, and not just a isolated view of one program versus another program. And so we can deconflict those feedback and redundancies because right now I was at a facility a few weeks ago, and one of the program people told me, they said, yeah, one program office was in here, they told me to go right, another program office the next week told me to go left. I don't know which way I'm supposed to go, I'm standing still.
Yeah.
And so we can deconflict that at the review level. And so the self-inspection team will be there to help bring everybody up and help them prepare as they get ready for the JCO inspections or the IG inspections. And I also think it's going to be a powerful tool when we get new leadership into a facility. They can request a self-inspection team come out and do an assessment for them. Interesting. Of where they are, so they have a roadmap of what are things that they need to focus on as they walk into a new job.
I like that. That's one example from the field I know. Another one I've heard you talk about is policy, the way policy gets done. So a lot of our big offices that do policy, a big goal of this is to clean up just sort of the chaos of what it takes to make policy. So how does RISE do that, where we're at now versus where we're headed?
So what RISE does is it allows us to put in a new policy structure. So right now, policy has been pushed down to each program office, and the way we do coordination is not the most effective. And it also delays policies. It takes years to get policies out, and then they're not well coordinated even in that through that process. So by going to this structure, we'll be laying out a new policy model where we'll have a policy council that will review those policies at the top, at the very beginning, to make sure that we get the right mix of players. So currently, one of the processes that we use is we send every policy out to all 400,000 of our employees can comment on a policy when it's in the early draft stages. That's not that effective, because if I'm a podiatrist and it's a cardiac issue, one, I don't need to see it. It doesn't, it's not likely going to impact me.
Yeah.
But two, if I non-concur on it and I'm at a facility level and I don't understand what the why is behind it, then you have to go through and work through all of those non-concurrences and work with the team to get that through. And it takes years to get everybody up to speed as to what is going on. And sometimes it might have just been, me at a facility level giving an offhanded comment, like, oh, that just seems odd. Why would we do that? And you don't know how to take that, and it takes a while to get back to that individual if you got 400,000 people giving that type of feedback.
Yeah.
So having a structured policy approach where we will streamline and say, this needs to have informal coordination between A, B, C, and D, and this VISN and this facility, and do a representative sample of those organizations, will give us a faster feedback loop than we have today.
I'm just trying to get a policy to get a salad bar back in the VHA canteen. That's my go-to. I digress. Looking forward to the next phases and all that, what's your message to staff, both leadership, if program offices, VISNs, folks in the field, what sort of message do you have, for them going forward as far as feedback, leaning in, that sort of thing?
So my message on RISE is fairly simple. We're going to have centralized implementation and guidance and local execution. But the purpose of this is to empower the local facility.
Okay.
We want the hospital directors to be hospital directors. We want the hospital program folks to be able to operate their program. We want people to know that if they have a question about what the guidance is, that they have one belly button to ask that question to, and that they can get a clear, concise answer. Having the health service areas, or the markets, if you will, to be able to go to that have likely had that from other hospitals in their same market will streamline that process. If they need clarity that goes up higher to the operations center, they can get that right from the operations center. Having an ability of having a HSA that can now focus down on them as their full-time job to help them coordinate and work across the market areas and to put the veterans first to make sure that we have the right resources in the right place. That's what this is about.
Yeah.
It all comes down to what the Secretary and I continue to say, our job is to put veterans first.
Awesome. For anyone looking for more details on sort of the structure of the HSAs, the VISNs, the business functions, we did that in the initial RISE video. We'll make sure that that's available to folks.
Can I add one to that?
Sure.
So in the all-employee memo that goes out on the IOC, there's a link to the RISE website.
Yep.
And we have a RISE website out there that will continue to be updated as different activities come along. And so look at the RISE website as well.
Yep. Stay tuned in there. It's digital.va.gov/RISE is the website there. And yeah, we'll do more of these. This was terrific. Really appreciate your time doing this. That brings us to close to the RISE update. Thank you for tuning in, sir. Again, thank you for walking us through what we've been doing and where we're headed next. On behalf of Undersecretary Bartrum and the National Broadcast Studios, I'm Ron Haskell. Thank you for your continued engagement and all that you do for veterans. Be well.